Hello and welcome to the book review of Back Mechanic by Dr. Stuart McGill. This is a seminal work in the field of spine health and rehabilitation. Dr. McGill, a world-renowned spine biomechanist and researcher, brings a wealth of knowledge and clinical experience to this comprehensive guide aimed at individuals suffering from chronic back pain. The book is not just a manual of exercises but a holistic approach to understanding and managing back pain through principles rooted in biomechanics. Author background: Stuart McGill is a professor emeritus of spine biomechanics at the University of Waterloo and has spent decades researching the causes and treatments of back pain. His work is highly respected in the field of biomechanics and rehabilitation, making him an authoritative voice on the subject. McGill's methodology is informed by extensive research and practical experience, which he translates into actionable advice in Back Mechanic. Book structure: Back Mechanic is methodically structured to guide readers through a step-by-step process of understanding their back pain, diagnosing its causes, and applying the McGill method to achieve relief. The book is divided into several key sections. 1. Understanding your back pain. 2. Assessment and diagnosis. 3. The McGill method. 4. Pain management strategies. 5. Case studies and success stories. 6. Integrating the McGill method into daily life. Each section builds upon the previous one, providing a comprehensive approach to back pain management. Section 1. Understanding your back pain. Overview of back pain. McGill begins by explaining the complexity of back pain, emphasizing that it is often a result of poor movement patterns rather than specific spinal damage. He introduces the concept of spinal hygiene, which involves maintaining good spinal mechanics and posture to prevent pain. According to McGill, many people develop back pain due to cumulative stresses and improper movements rather than acute injuries. Spinal mechanics. The book delves into the biomechanics of the spine, explaining how different movements and postures can affect spinal health. McGill discusses the importance of understanding the mechanical function of the spine and how deviations from normal mechanics can lead to pain and injury. The role of core stability. McGill highlights the critical role of core stability in maintaining spinal health. He explains that a stable core helps protect the spine from excessive stress and strain. This section introduces the concept that spinal stability is different from spinal strength, emphasizing that stability is essential for preventing and managing back pain. Section 2. Assessment and diagnosis. Self-assessment techniques. In this section, McGill provides a series of self-assessment techniques designed to help readers identify the underlying causes of their back pain. These techniques include various tests and exercises that can reveal issues such as muscle imbalances, poor posture, and incorrect movement patterns. Diagnostic tests. McGill introduces specific diagnostic tests to evaluate spinal health. These tests help determine how different movements affect the back and can pinpoint which activities exacerbate pain. The diagnostic approach is both systematic and practical, allowing readers to assess their condition in a straightforward manner. Identifying pain triggers. The book emphasizes the importance of identifying pain triggers to develop an effective treatment plan. McGill discusses common pain triggers such as prolonged sitting, improper lifting techniques, and poor posture. By recognizing these triggers, readers can make targeted adjustments to reduce their pain. Section 3. The McGill method. The Big 3 exercises. At the core of the McGill method are 3 fundamental exercises: the McGill curl-up, the side bridge, and the bird dog. Each exercise is designed to strengthen and stabilize the core, addressing specific aspects of spinal health. The McGill curl-up. This exercise targets the abdominal muscles without putting excessive strain on the spine. It is designed to improve core stability and reduce back pain. The side bridge. This exercise strengthens the oblique muscles and enhances lateral stability. It helps in maintaining a balanced core and supporting the spine. The bird dog. This exercise focuses on extending and stabilizing the spine while engaging the back and abdominal muscles. It improves overall core strength and stability. Movement re-education. McGill emphasizes the importance of learning how to move properly to avoid exacerbating back pain. He provides guidelines for safe lifting techniques, posture correction, and movement modifications. This section is crucial for readers who need to integrate new movement habits into their daily routines. Progressive exercise regimen. The McGill method includes a progressive exercise regimen designed to gradually build core strength and stability. McGill provides detailed instructions on how to progress through the exercises based on individual capabilities and pain levels. Section 4. Pain Management Strategies. Managing pain during recovery. McGill offers practical advice on managing pain during the recovery process. He discusses strategies for dealing with flare-ups, including activity modifications, pain relief techniques, and psychological approaches to coping with chronic pain. Integrating the McGill method into daily life. The book provides guidance on incorporating the McGill method into daily life. This includes strategies for modifying daily activities to prevent back pain, such as proper ergonomics at work and adjustments to exercise routines. Preventing recurrence. McGill emphasizes the importance of maintaining spinal hygiene and core stability to prevent the recurrence of back pain. He offers tips on how to sustain the benefits of the McGill method long-term and avoid common pitfalls that can lead to relapse. Section 5. Case Studies and Success Stories. Real-life examples. The book includes several case studies and success stories from individuals who have successfully applied the McGill method to overcome their back pain. These real-life examples provide motivation and demonstrate the effectiveness of the approach. Lessons learned. McGill discusses the lessons learned from these case studies, highlighting key factors that contributed to successful outcomes. These lessons reinforce the principles of the McGill method and provide additional insights into its application. Section 6. Integrating the McGill method into daily life. Daily practices and routines. McGill provides practical advice on integrating the McGill method into daily routines. This includes tips on maintaining proper posture, safe movement practices, and strategies for staying active while managing back pain. Long-term maintenance. The book concludes with guidance on maintaining spinal health and core stability over the long term. McGill stresses the importance of ongoing self-care and adherence to the principles of the McGill method to achieve lasting results. Conclusion. Back Mechanic, by Stuart McGill, is a comprehensive guide that offers a thorough understanding of back pain and effective strategies for managing and alleviating it. Dr. McGill's methodical approach, grounded in biomechanical research and practical experience, provides readers with a systematic way to address their back pain. The book's emphasis on core stability, proper movement, and spinal hygiene makes it a valuable resource for anyone seeking to improve their spinal health and overall quality of life. By following the principles outlined in Back Mechanic, readers can gain a deeper understanding of their back pain, implement effective treatment strategies, and achieve long-term relief. The book's detailed exercises, practical advice, and real-life success stories make it a powerful tool for anyone struggling with chronic back pain. If you find this review interesting, you'll love the detailed insights and practical advice in the book. Please read it to know more and subscribe for more book reviews. Until next time, take care and keep growing. Thank you.